The most common chemotherapy in gastric cancer is a combination of a platinum agent with a fluoropyrimidine that is unfortunately associated with particular side effects, in this case cisplatin. For the targeted therapies, we have one agent called trastuzumab that targets the HER2 growth factor receptor, but only about 8 to 10% of gastric cancer patients are amplified in this receptor. Hence, there is a need to identify additional targeted therapies. The investigators embarked on a phase 3 clinical trial involving about 320 patients, and these patients were randomized to either the paclitaxel regimen or the standard cisplatin capecitabine combination. What the investigators found was that there was no difference in both arms in terms of progression-free survival and overall survival, but in the paclitaxel arm, the patients in that particular arm were associated with better objective response rates, better quality of life, and it was also better tolerated. These results are very promising, and they do suggest the possibility that a paclitaxel-based regimen could be considered as a first-line treatment for gastric cancer. There are also other reports, one particular from a French group published in JCO last year about a different FOLFIRI-based regimen that seems to be as efficacious as the triplet ECX combination that's currently used in the UK. So there is definitely potential, and this study needs to be further replicated. One concern is that paclitaxel is also, because it is used as a second-line therapy, in countries where ramucirumab is also approved, one has to consider whether or not it is acceptable to use capecitabine as a first-line treatment. And so this may motivate the search to target particular populations of patients where this paclitaxel as a first-line therapy might be much more appropriate. Previous work has shown that FGFR2 is frequently amplified in gastric cancer, and so they have assessed in a phase 2 clinical trial whether or not a compound called AZD5457, where it targets FGFR2, may be appropriate for this particular class of FGFR2 amplified gastric cancers. So this was a phase 2 clinical trial, and the definitive results are not clear yet. But what the investigators reported was that after screening about 135 gastric cancer patients, they identified FGFR2 amplification in about 9% of cases, which is consistent with previous studies, but high-level FGFR2 amplification in about 5%. Of the patients that were treated, about 1/3 of them responded to the drug with a confirmed relative response. So obviously, not all patients with high levels of FGFR2 actually respond to the drug. Further biomarker-based investigations by the investigators revealed that the patients that did respond, 3 of them in this particular study, were associated with very homogeneous FGFR2 amplification in the tumor. And in plasma-based studies, these patients were associated with high circulating copy number levels of FGFR2, and also by doing gene expression analysis on the tumors, that these were associated with a specific splice form of the FGFR2 receptor that seems to inhibit receptor internalization. So I think that what we're looking at is a further biomarker-based work to really identify that specific cohort of FGFR2 amplified patients that will respond to this particular therapy. More work needs to be done in clarifying how best to target this particular population. There's a lot of developmental work going around the field suggesting that monotherapy treatments with a one receptor tyrosine kinase targeting agent may lead to upregulation or amplification of companion receptor tyrosine kinases. So I think for future work, firstly, it involves 3 things. Firstly, it involves more biomarker analysis to find the specific cohort of FGFR2 amplified patients that will respond to the drug. Secondly, what are the co-occurring alterations in the receptor tyrosine kinase family are happening in the patients that don't respond. All of these trials are done as monotherapy, and I think that one of the challenges to see, will we get better effects if we can combine these targeted agents with chemotherapy? Gastric cancer in general is thought of as an Asian disease in the sense that most of the cases actually happen in countries in this part of the world where ESMO Asia is being held this year. And also there is intriguing evidence emerging that patients with gastric cancer from different countries seem to be responding differently, even in these multicentre phase 3 clinical trials. So I would say that for these regimens to become standard of care, it would be very, very useful to see replication of these studies in multiple countries and in different cohorts, both in regions of high endemic incidence as well as moderate endemic incidence.